Alright, here's my client's release form. So, thus far, I have checked my doctor's orders, reviewed my patient's history. Also, since we're not taking height and weight today, my patient, I reviewed that my patient weighs 130 pounds and is 5'3". I've provided patient privacy, washed my hands. Hi, how are you doing today?
I'm good, thank you.
Okay. Good, I'm Lauren. I'm going to be your student nurse. I'm just going to be performing your assessment today and taking your vitals and all that stuff. Can I just have your full name and date of birth, please?
Arena Pizzullo, February 4th, 1994.
Alright, thank you very much. Let's get started. Okay, so I'm just going to start with your vitals. First thing I'm going to do is your temperature, alright? Can you just put this under your tongue?
Yeah,
for me?
we have to switch now.
Thank you.
No, I'm sorry.
Okay, 97.9, normal. Alright. Just gonna take your pulse here. You can see your hand. Alright, let me just take this. Thank you.
Okay. All right.
Now, most of the girls over there, you know, where we put the checkups.
Alright, so I have a pulse rate of 80 beats per minute and a respiratory rate of 20 breaths per minute.
So like
So I'm
bounding
just gonna
for
do this pulse oximetry.
actually, yeah, that was pretty. Let me check that out. Or if I should thread it.
Okay, and she has SpO2 of 96%. So I'm just going to take her blood pressure here. Just get your arm, please. Thank you.
I hear it, but it's diminished. It's not super.
See? Alright. How's your day been?
It's going good, thank you.
It's good to hear. Alright. Just gonna listen right here. Feel for the brachial pulse.
Do you have that? I look at that. You missed that.
Okay, so I got 118 over 76 here. Is that it all? And that will conclude all of my vitals. So first I'm just going to start off by palpating your head and scalp. I'm checking for any abnormalities. I'm looking at hair distribution, color, any lumps, bumps, etc. Okay, and then I'm going to go straight into the lymph nodes. From there I'm going to check your post-auricular and pre-auricular lymph nodes, work down to your tonsillar, the submandibular and submental. And then can you just turn please for me? Check your post-cervical and then your deep cervical chain. And while I'm here, can you just swallow for me please? Alright, thank you. And by doing this I was testing 9 and 10, cranial nerves 9 and 10, the glossopharyngeal nerve and the vagus nerve. And then from the front, can you just lift your shoulders up against my hands, please? All right, thank you. And that's me testing for cranial nerve 11, the spinal accessory nerve. And last, I'm just going to check your facial symmetry, make sure that everything looks aligned here, and it does. All right, next I'm just going to check your eyes, okay? So just look at me, please. I'm going to test for pupil constriction here. Alright. And I'm going to check red reflex. Alright. And by doing this, I'm testing the cranial nerve 2, which is for vision. And now I'm gonna check the cardinal fields here. So can you just follow my finger for me? Just with your eyes, please. Alright, thank you. And by doing this, I'm testing cranial nerves 3, 4, and 6. That's the ocular, motor, trochlear, and the abducens. Okay, now I'm just going to check the patient's tympanic membrane. Make sure we have a nice translucent pearly gray color here. Alright, and the other side. Alright, all looks good. Throw that away, and then I'm just going to look up her nostrils here, check for color, mucosa, all of that. Everything looks good. And now we're going to do the whisper test. So all I'm going to do is I'm going to cover this ear over here, and I just need you to repeat back what I'm whispering to you, okay?
Okay. 8XB.
Okay.
H7.
Alright, thank you. And this is testing for auditory, which is the cranial nerve 8. And then I'm going to perform a sniff test, so I just need you to identify a smell for me. So first thing I'm going to ask you to do is close your eyes, please. Okay. I'm going to hold something under your nose and ask you to tell me what it smells like to you. Alcohol. Alright, thank you. Okay, so next I'm just going to have you open your mouth for me and say ah. And press down on the tongue. I'm going to check for oral mucosa, all that stuff. And this is testing cranial nerve 12, the hypoglossal nerve. While doing that, I was also checking their gag reflex, but I'm not actually going to gag her. Next. First. Okay, we'll put it back in the Next, I'm going to check your jaw. I'm just going to have you open and close your mouth for me, please. Okay, go side to side. Alright, thank you very much. And that is checking cranial nerve 7, the facial nerve. Last, I'm going to do the sharp dull test here. So, I just need you to tell me which side is sharp, which side is dull. This one's going to be sharp and this is dull. So just keep your eyes closed and let me know what you feel, okay?
Okay. Dull. Sharp. Dull. Sharp. dull, sharp, dull, sharp, sharp, dull, sharp.
Alright, am I doing that? I was testing cranial nerve 5, the trigeminal nerve. Alright, so now I'm just gonna auscultate all over the lung fields here. And I'm just gonna start the bronchial.
Yeah.
Take a deep breath in.
Yeah.
Deep breath. And then down to bronchiovesicular. Deep breath. Deep breath.
And we might have to pause.
Breath.
My phone never.
And then vesicular. Deep breath. Deep breath. Alright. Just gonna do the back side now. Posterior side. We start with bronchovesicular. Deep breath. Deep breath. Deep breath. Deep breath. And then down to vesicular. Deep breath. Deep breath. Deep breath. And one last time, deep breath. Alright, thank you. And so I did not hear any adventitious sounds or anything of that nature. Everything sounds clear. So now I'm just going to be percussing over the lung fields. Just hold this open.
Okay, we're just doing the video. Okay.
To the posterior side.
Stop sleeping.
No, I want to. I need to sleep also. This is good because I'm true. We got 2.5 hours in.
Okay. All areas are resonant. There's no dullness or anything like that. And so now while I'm on the back, I'm just going to perform some tactile firmitus. I'm going to have the patient say 99 as I place my hands down her spine. I'm looking for equal bilaterally. Okay, go ahead and say 99.
99,
Again.
99,
Mm-hmm.
99, 99, 99.
Alright, and everything's equal on each side. This thing. Just going to check for expansion. You can just take a deep breath for me. Alright, and both sides expand equally. Okay, so at this point I'm just looking at the general appearance of the chest, seeing if there's any heaves or anything like that. And then I'm just going to auscultate the areas of the heart. So I'm going to start with the aortic.
Okay, now cover your left ear for
It's
me.
going to be right over here. And this is where S2 is going to be heard louder than S1. I'm going to move to the other side.
You pass the whisper
About the
test.
second intercostal space.
Now,
That's where we hear the pulmonic. And S2 is also the loudest here.
looking in your nose.
If I go down, one more intercostal space, I'm going to be at Erb's point. And right here, this is where we would hear both S1 and S2 equally.
I'm
gonna go down one more time.
Intact.
And this is tricuspid.
Okay, I forgot
Tricuspid, S1 is going to be louder, and this is going to be the dub that you hear.
I have one in my lap bag.
I found
There's mitral here.
There's some lights over there too.
Mitral S1 is going to be the loudest out here, and that's the lub you're hearing. Everything sounds good, everything sounds strong. Next, I'm just going to assess for some of the pulses. We're just looking waist up here. So I'm going to start by feeling for the temporal pulse right around here.
The trigeminal.
Okay. Then I'm going to
Now,
feel for both
this is gonna be
carotid
soft, and this is
pulses.
sharp. You
But
can
I'm
just
only
let
going to
me
do
know
one
what
at
you
a
feel
time.
with your eyes closed.
Okay.
Okay.
Check.
And I'm going to do brachial. Feeling for both sides.
Check. Check.
Okay.
Check.
I'm also going to feel
Okay,
apical
good.
under here.
Hannah's never been good.
All
Now
right.
if you could open your
Just your arms again.
At least she's
And then I'm going to
Yeah,
feel
stick your
radial
tongue out.
in here.
say ah.
she gets very
Very
apprehensive.
good.
Your pulse
See if
equal.
the
Make
gums
sure
are
there's no
back,
trills or
no
anything like
bellies are
that.
bleeding.
Yeah,
We're going to
Yourself
use
And
out.
then
this
ulnar as
and
well.
voice.
Very bad.
Lip color is
Sure all the
pink
pulses
and
are
moist,
equal.
No dry or cracking or
All
sores.
right, and everything sounds good. So for my closing actions here, I'm just going to wash my hands and document everything I've found here, and the patient seems to be in perfectly good health. And that will complete our assessment for today.